Colon cancer is the third leading cancer in the United States, and it's the second leading cause of cancer death in the United States. And the interesting thing about colon cancer is that it is preventable in that we have a really set pathway from a precursor lesion, being a polyp, onto a full-blown cancer.
It is a preventable cancer. By doing the colonoscopy, we can remove polyps, and the majority of the colon cancers that we see today begin in polyps. So if we can remove these polyps at the time of the colonoscopy, we decrease your chance of developing colon cancer.
Colon cancer is one of the leading causes of cancer death in the country, and it is one of the only cancers that we can prevent by doing a test called a colonoscopy.
The rate of colon cancer in the United States is starting to drop, and the only major difference we've done is to start instituting widespread colonoscopy screening. We are not looking for cancer in doing screening, we're looking for polyps.
So a colonoscopy allows us to try and detect these polyps ahead of time before they've turned into a cancer and remove them, thereby preventing that cancer.
Patients with no symptoms often question why they should get the test at all. If one waits till they have symptoms of colon cancer such as bleeding or abdominal pain, that usually signifies that the cancer is advanced or perhaps metastatic, and therefore much more difficult to treat.
Several institutions, including the National Cancer Institute, the American Cancer Society, all recommend that patients who are asymptomatic and do not have any family history of colon cancer undergo a screening colonoscopy starting at age 50. If you have symptoms suggestive of colon cancer, such as rectal bleeding, abdominal pain, or if you have certain diseases such as inflammatory bowel disease that predispose you to colon cancer, or a family history of colon cancer, you may have the screening colonoscopy starting at an earlier age.
The key thing to remember is that you have to take a lot of clear liquids that day, which could include apple juice, white cranberry juice, white grape juice. You can have any of the sports drinks, Gatorade, Propel Water, Powerade. You can have chicken broth, beef broth, anything that's clear, and we'd like you to take at least a half gallon to a gallon of those clear liquids. Water is also an essential part of your clear liquid diet.
You will come into the endoscopy unit in the morning. The nurses will insert an intravenous line, and through the intravenous we will give you medication to make you drowsy. Over 90% of people will sleep through the test. A small percentage of the people will be awake enough to watch somewhat, but as long as they're comfortable, that is our main result. The test itself takes about 15 to 20 minutes. A small flexible scope is inserted into the rectum and passed under direct visualization to the end of the colon. As we take the colonoscope out, if we see any of the polyps, we remove them. Usually we use a small wire snare that will actually lift the polyp up and cauterize the base of it, and we remove it right through the scope.
A polyp is basically a small growth, a mushroom-sized growth on the colon lining that could grow into cancer years down the road if you leave it in. Our goal through the colonoscopy is to catch this polyp at one of the earlier stages before it transforms into cancer.
The advantage of the colonoscopy is at the time of the procedure we can remove any polyps, therefore making it a one-stop test that not only would diagnose polyps but actually remove them at the same time.
Complications are rare, but they do occur. There are two serious complications that patients need to know about.
Bleeding can actually happen right at the time of the procedure. It can also happen upwards to about 1 to 2 weeks after. So I tell everybody just to keep a close eye out after they have their colonoscopy for a few weeks to look for any signs that bleeding might occur.
Well, now the complication, which is extremely rare, is perforation of the bowel, making a hole or tear in the colon that requires surgery to fix. This is extremely rare. It occurs approximately less than 1 in 1,000 cases, but it is a real complication, and certainly patients need to know about it. If this does occur, patients will be seen by a surgeon the same day and will require surgery to repair the hole.
It's a very low-risk procedure, and the benefits of colon screening truly outweigh the risks.
We do know the results right away. That's the benefit of the colonoscopy, because you're seeing things as you're doing the procedure, and you can address it right there and then, either biopsy it, remove it.
Many patients are apprehensive about having a colonoscopy. The majority of patients don't feel any pain or discomfort during the procedure, and the complication rate is quite low.
Now ultimately we recommend that everybody over age 50 have a colonoscopy. But there are certain circumstances where we'd recommend you have a colonoscopy before age 50. And that may be because you have a family history of colon cancer, family history of colon polyps, or some diseases like Crohn's disease or ulcerative colitis that may require you to have a colonoscopy earlier in that?
Everybody should have a colonoscopy for screening for colon cancer. It is an equal opportunity disease that doesn't really discriminate based on age or sex.
It's, I'm sure, typecasting, but a majority of the men we have come in because their wife has prodded them to come in and get done because of their concern about them. And I'll turn around to the wife and say, have you had your colonoscopy done? And they look shocked because they never even considered it. It's unfortunately an equal opportunity disease, will affect anyone, no matter other health risks or if family history or not. So we recommend across the board, really everyone consider screening for colorectal cancer.